Good day everyone, I am Lady Elaine Poquiz, a student nurse at Isabela State University from DSN 1-3. And in this video, I will be performing my written demonstration on the assessment of the nose, mouth, thorax, and sinuses. Prior to the conduct of the assessment, the first thing to do is to perform proper hand hygiene, which I already did a while ago. So let me just sanitize my hands to ensure that I don't spread any microorganisms. And also, I already gathered all of the equipments and materials that I will be needing later on for the assessment. They are placed over here. Okay, let's begin. Good day, ma'am. I am Lady Elaine Poquiz, your student nurse for today. Would you please confirm me your name and age?
My name is Roxanne D. Castillo, 18 years old, July 14, 2004.
How would you like me to call you, ma'am?
By my name,
Okay, Miss Roxanne, what language do you prefer? Is it English or Tagalog?
can be both.
Okay, thank you. Miss Roxanne, we are here today to assess your mouth, nose, throat, and the sinuses. This is done to ensure that everything is fine and normal, and also to determine if there are any abnormalities or any potential risks that are specific to your mouth, nose, throat, and sinuses, so that we could prevent them from further complications. Do you have any questions before we proceed?
Nothing more.
Okay, thank you, ma'am. Miss Roxanne, there are parts of the assessment wherein I will be touching or palpating certain parts of your body. Would you consent me to do that?
Okay, ma'am.
Okay, thank you, ma'am. Miss Roxanne, I assure you that all of the gathered information later on will remain confidential between you and me and to the attending physician that I will be referring you to as necessary. Okay, I also close the doors and the windows to provide privacy for you as my client. Okay, now that we're all set, let's now begin. The first part of the procedure is the assessment of the mouth. Okay, let me just position in front of you. Okay, the first thing I'm going to do is to inspect the lips, noting for color and consistency. Okay, kindly purse your lips, ma'am. Okay, let me inspect. Okay, thank you. I have observed that there are no swelling, pallor, as well as bluish color, which is normal. And the general color of your lips is pinkish. And it is moist and smooth, which is a good indication of hydration. Okay, next naman po is I'm going to inspect the teeth and mouth, noting the number of teeth, color, and condition. Okay, kindly open your mouth for me, please. Nga po tayo, may ige. Okay, I'm also noting for any damage on the teeth. 1, 2, 3, 4. Okay, thank you, ma'am. As I have observed, you have a total of 28 teeth, which are yellowish in color. There is no missing teeth. I also observed the presence of caries in your upper frontal teeth. There are 4 of them and another one on the lower canine. Okay, there are no presence of repairs or any cosmetics. Okay, next po ma'am is you are going to bite down as if you are chewing something. Yung parang gumunguya po kayo. Okay, and then I'm gonna inspect. Tuloy lang po. Okay, thank you ma'am. Okay ma'am, I can see that properly aligned naman po yung upper and lower jaw ninyo, which is good. Okay, next naman po is I'm going to retract the lips, and then doing that, let me put on my gloves first because I'll be touching your lips. Okay, I have now my gloves on. Let me inspect po your gums. Open to your mouth and then hahawakan ko po yung mouth natin. Okay. Okay, good. Okay, good. Okay, as I have observed po, yung gums po natin is deep pink in color, which indicates a healthy gums. Okay, and I also observed that there is no presence of lesions, no ulcerations, and no inflammation. Next step is to inspect the buccal mucosa for color and consistency, as well as the Stensen's duct. Okay, allow me to grab my tongue depressor. Dito po, ma'am, nganga lang po tayo. Okay, open your mouth po.
Wait lang.
Yes? Okay, open your mouth for me, please. Okay, looking good. Okay, may funny po, ma'am. Okay, wait lang po. Hold niyo lang po yan. Thank you. Okay. As I have observed po, your buccal mucosa is moist, pink in color, and has a smooth consistency. And there are no presence of ulcerations or any lesions, which is good. Okay, next step naman po is to inspect and palpate the tongue. Nga lang po tayo ulit. And then stick out your tongue, please. Labas po natin. Okay. And here po, I am checking if there are any tenderness, ulceration, or lesions. Okay, wala naman po. Kindly stick your tongue up po sa palate. Okay. Looking good. Okay, thank you, ma'am. As I can see, your tongue is positioned in the center. It is deep pink in color and it is moist. And there are no presence of any lesions or any ulcerations. For the ventral surface naman po of the tongue, it is blush pink in color and there are no presence of any lesions, which is good. Next step is to inspect for the Wharton's duct. Okay, open mo po ulit yung mouth ni ma'am and then you're gonna stick your tongue up again. Taas po. Okay, medyo yumuko po tayo ng konti. Ayan, thank you, ma'am. Okay, as I have observed, there is no inflammation on the Wharton's duct, which is good. There is no presence of lesions, ulcerations, and tenderness. Okay, next step po is I'm going to observe the sides of your tongue. In here po, I'm going to use a gauze pad to hold your tongue. Okay po. Okay, kindly stick out your tongue po and with your mouth open. Okay, I'm now palpating your tongue. Looking for the sides. Okay, looking good. Okay, thank you, ma'am. There is no presence of ulceration, lesion, or any apparent nodules. Okay, which is good. Question lang po, did you taste anything po nung hinawakan ko yung tongue ninyo?
Meron po, ma'am.
Ano po yung lasa na nalasahan nyo?
Parang latex po.
Okay, okay. Maybe yun po yung nangalasahan niyo po yung gloves. Okay, that only means na yung ability nyo to taste is present, which is good because it only means that there are no abnormalities in your taste. Okay, let me discard it. Next naman po is I'm going to assess the ability of your tongue or the strength of your tongue. So dito po, ma'am, all you need to do is to press the tip of your tongue against your cheeks and resist the force coming from my fingers. Okay po ba? You ready, ma'am? Go. Okay, good. Sa kabila naman po. Okay, feeling strong. Okay, ma'am, very good. You did it with ease and I have felt the strength of your tongue. Okay, next naman po is I'm going to assess the hard and soft palates as well as the uvula. Okay, in here po, ma'am, I will take note of the normal odor of the mouth. So would you please say continuously? Ready? Go. Okay, very good, ma'am. Thank you. Okay po, ma'am, as I have observed, the hard and soft palates are intact and they are light pink in color. For the soft palate, it has a smooth consistency. For the hard palate, it has ridged surfaces. For the uvula naman po, it is positioned midline, which is normal. And there are no presence of inflammation, no swelling, no lesions, and no ulceration. Next step po is I'm going to inspect the tonsils. Kindly open again po yung mouth natin. Okay, I'm just gonna lower your tongue. Okay, thank you, ma'am. Okay, ma'am, the tonsils are pink in color and they are symmetrical. There is no presence of inflammation, no presence of lesions or any exudates. And also the tonsil size is in grade 1, meaning they are barely visible, which is normal. Okay? Next step is I'm going to inspect the posterior pharyngeal wall. Okay, ma'am, kindly open your mouth and stick your tongue. Okay, let me check. Okay, thank you, ma'am. As I have observed, the color of the posterior pharyngeal wall is reddish pink, which is normal. And the surface is smooth and there are no presence of lesions or any exudates. Okay, we are now done with the mouth and throat examination. Let me just remove my gloves before we proceed to the nose. Okay. Let me just sanitize my hands. Okay. Ano to yung lasin? Ay, dami ko. Okay na na. Ilang isang oras na ata yun.
21.
Okay, let us now proceed to the assessment of the external nose. Allow me to inspect and palpate the nose po.
Okay, ma'am.
Inspect ko lang po muna. Okay, good. Hawakan ko na po. Okay. As I have observed, the nose is in normal shape and size, and it is appropriately proportioned to your face. And the color is in uniform with the facial skin. Okay, after palpation, I have assessed that there is no presence of lumps, lesions, or any masses, which is good. Next, I am going to check the patency of the airflow through the nostrils. Okay, dito po mama, ang gagawin po natin is you're gonna occlude one of your nose and then breathe po tayo. Wait lang, lang kasi. Okay, dito po ma'am, all you need to do is to occlude one of your nose, to cover niyo po siya, and then breathe in, breathe out po tayo. Okay po? Go. Breathe in. Breathe out. Breathe in. Breathe out. Okay, sa other side naman po. Breathe in. Breathe out. Breathe in. Breathe out. Okay, very good. Both nostrils have no obstruction of the nose. Ibig sabihin po, hindi po kayo nahirapang huminga, which is good. Okay, next. Inspection of internal nose. Internal nose is pink in color and moist. There are discharges but no. There are no discharges and no bleedings. Okay, the next step naman po is the inspection of the external nose. Let me grab my pen light. Okay, tingnan na po tayo ng konti. Let me inspect. Okay, thank you ma'am. It looks good naman po. There are no signs of swelling. The internal nose is pink in color and it is moist. And there are no discharges and no bleeding, which is very good. Okay, let us now proceed to the assessment of the sinuses. But first, let me just sanitize my hands again. Okay, the first thing that we're going to do is I'm going to palpate the frontal sinuses and the maxillary sinuses. Allow me to palpate po. Let me know if you feel any pain. Okay, sa maxillary sinuses naman. Did you feel any pain po? Okay, very good. As I have observed, there is no tenderness, no lesion, no masses or lumps on both of the frontal and maxillary sinuses. Okay, the next step is I'm going to percuss the frontal and maxillary sinuses. Okay po ma'am. If you feel any discomfort, sabihin nyo lang po. Okay po? Okay, wanna start? Did you feel any pain po?
Nothing.
Okay, since you did not report any pain, it only means that the sinuses are non-tender, there are no swelling, and it is a good sign. Next step is I'm going to trans-illuminate the frontal and maxillary sinuses using a pen light, okay? Can you inspect po? Okay, on the other side. Okay, sa maxillary sinuses naman po, I need you to open your mouth. Open po, open. Okay, other side, open po again. Okay, very good. Okay, for the frontal sinuses, there is the presence of warm glow, which is normal. And for the maxillary sinuses, I have observed a reddish glow on the hard palate, which is an indication of an air-filled sinuses, which is normal. Okay, we are now done with the assessment. Let me just document all of the findings, and I will make necessary referrals to a physician if you needed one. Thank you for your time and cooperation. Have a good day.